we, as clinicians especially, can get very wrapped up in our own little worlds, and that we're very siloed. Even as a UT system, within each UT medical school and center, I think it becomes very easy to really not look outside our day-to-day world. And I think there's so much knowledge and expertise across the system that we really need to come together to share. Another thing that I heard one time that I think is pertinent is I'm very involved in quality improvement, and someone said quality improvement is local. You have to understand your context and your environment. And I think that UT System schools, although we're in different cities and our local environments might be slightly different, we share a lot of similar resources, missions, goals, and that we can really learn a lot together. And it's really by sharing best practices and challenges and trying to learn together that we can move the needle fastest. I am involved in what's called comparative effectiveness research, where you look at two treatments that are available to patients that potentially are widely used in practice, but where we don't have good evidence to say one treatment is better than the other. So trying to understand what treatment is best also for which patient, because sometimes one size does not fit all. So I think we have to think about general effects, but also subgroup effects for specific populations. And then another component of my research has to do with implementation, which is getting people to adopt the evidence once it's generated. I think a lot of the research and the findings that we can potentially generate can impact policy, and we actually need legislators to help us to implement those policies for population impact. I think oftentimes small studies may impact local patients, but we need to be thinking broader as a system, as a state, and even as a nation about how to improve care. TRC4 is a wonderful opportunity to really leverage the expertise and the resources across UT system to really propel the concept that I talked about in my keynote, which is a learning trauma system where we're continuously learning, improving, and innovating while delivering care. And this model is really what we should be striving for.